Hormonal birth control linked to increased risk of breast cancer. Hormonal birth control, also known as the birth control pill, is a widely used method of contraception. However, recent studies have shown that hormonal birth control may be linked to an increased risk of breast cancer. Now, we will explore the link between hormonal birth control and breast cancer and discuss what women can do to protect themselves. Hormonal birth control works by using synthetic hormones to prevent ovulation, which in turn prevents pregnancy. The two main types of hormonal birth control are combined oral contraceptives, which contain both estrogen and progestin-only contraceptives, such as the mini pill, the implant, and the hormonal IUD. Both types of hormonal birth control have been linked to an increased risk of breast cancer, although the risk appears to be greater with combined oral contraceptives. Studies have shown that women who use hormonal birth control for more than 5 years have a slightly increased risk of developing breast cancer compared to women who have never used hormonal birth control. This risk is highest for women who started using hormonal birth control before the age of 18. The risk also appears to be greater for certain subgroups of women, such as those with a family history of breast cancer or those who have a BRCA mutation. However, it is thought to be related to the synthetic hormones used in hormonal birth control, which can stimulate the growth of breast tissue and increase the risk of mutations in the breast cells. Additionally, hormonal birth control may affect the immune system and the way the body responds to inflammation, which can also contribute to the development of cancer. While the increased risk of breast cancer associated with hormonal birth control is concerning, it is important to note that the overall risk is still relatively small. The American Cancer Society estimates that the absolute risk of developing breast cancer as a result of using hormonal birth control for 5 years is 1 in 1,000. This risk increases slightly with longer use of hormonal birth control, but it is still small compared to other risk factors for breast cancer, such as age, family history, and obesity. Despite the small risk, it is important for women to be aware of the potential link between hormonal birth control and breast cancer and to take steps to protect themselves. While these methods are not as effective as hormonal birth control, they do not carry the same breast cancer risk. Another option is to talk to a healthcare provider about the best type of hormonal birth control for your individual situation. For some women, the benefits of hormonal birth control may outweigh the small risk of breast cancer, especially if they have other risk factors for pregnancy complications. In these cases, a healthcare provider may recommend a progestin-only contraceptive, which has been shown to carry a lower breast cancer risk than combined oral contraceptives. This includes maintaining a healthy weight, exercising regularly, limiting alcohol consumption, and getting regular breast cancer screenings. In conclusion, hormonal birth control has been linked to an increased risk of breast cancer, although the absolute risk is still relatively small. Women who use hormonal birth control should be aware of the potential risk and consider switching to a non-hormonal form of contraception.